We head to Somalia because Somalia partners with the World Health Organization to distribute life-saving materials to African countries meant for the fight against coronavirus global pandemic. Medical equipment from the WHO and Jack Ma Foundation are expected to consolidate efforts to contain the deadly disease in Africa. Health experts have warned that Africa could be the next epicenter of COVID-19, but authorities are not relenting in their fight. Let's have more details of that in this report.
The Bole International Airport Africa Humanitarian Air Hub is now fully operational, and the World Health Organization and the World Food Programme coordination effort is making supply delivery to African countries for their fight against COVID-19 possible.
With this partnership, life-saving events are getting to our countries, to all our countries in the African region. This is something that must be commended and must be praised, because we are being able to send supplies and life-saving supplies in the middle of this pandemic to our countries in Africa.
Ethiopian Airlines, in charge of the actual delivery, has already made first round of supplying these medical consignments to respective African countries, and says swift deliveries will continue in the coming few days.
So it will continue geographically closer countries like Djibouti, Sudan, Uganda, Tanzania. So it will continue like that, spreading to West, South and East Africa. We'll have 50 countries to cover. The schedule is with 737-800.
At the moment, more supplies for coronavirus prevention and treatment are making their way from the rest of the world to Africa. The soon-to-come supplies include one from WHO and the other from Jack Ma Foundation. And this humanitarian air hub will receive all and deliver it to respective nations in the coming few days.
So instead of having two flights, the same cargo will have two shipments. One coming with supplies coming from WHO, the second part coming from the Jack Ma Foundation, and we will arrive in countries, and countries will be informed of what they have coming there. So the WHO representative in each country with the Ministry of Health will be there to actually get these supplies when they arrive in a coordinated manner.
On the other hand, and despite a relatively enough COVID-19 related supplies at hand, African states remain to be on high alert. Both WHO and Africa CDC agreed the worst of the coronavirus pandemic is yet to come, and states must alert their citizens to practice utmost precautions and personal protection now more than ever.
From the report there in Addis Ababa, Ethiopia, instead of Somalia, as I earlier mentioned.